Which VBG worries you more? A patient with a pH of 7.24 and a PCO2 of 60, or a patient with a pH of 7.24 and a PCO2 of 90? I would argue that this one is far more concerning than the one on the right, even though the PCO2 on the right is so much higher. The reason is because this is acute CO2 retention versus chronic CO2 retention. So out of all of the metabolic and respiratory compensation things that you had to remember in medical school, the one that I have really memorized is this one. A patient with acute CO2 retention will have a drop in their pH by 0.08 for every increase in their PCO2 by 10. Whereas a patient with chronic CO2 retention will have a drop in their pH by 0.03 for every increase in their PCO2 by 10. So in this case, this patient has acute CO2 retention. They're going to need BiPAP, and they're going to need to go to the ICU if not improving. And for chronic patients, this is essentially their baseline. These patients can actually be managed on the filter